How the Post-Birth Alert Orange Bracelet program is transforming postpartum care.
I am Danielle Wittig. I am the perinatal quality nurse here at FHN Hospital in Freeport, Illinois.
What is the Post-Birth Alert Orange Bracelet?
It's actually one of those amazing stories how just interacting with people and broadening just beyond the people that you work with every day really can make a huge difference in outcomes. So our director here at FHN had a colleague that she worked with at another institution who currently works at Advent Health Zephyrhills in Florida. She was at a conference and had heard a patient's story about coming to the emergency room and sitting in a waiting room. And they asked her, what would help us get you through triage quicker and not sit in the waiting room? And she said, I feel if we had something bright that took attention to me as a postpartum patient, I really think that there could be some changes in the outcomes of these patients. So they took that and went to work on how to be most effective for the postpartum community, and they decided on the orange bracelet, orange in color, with the words post-birth alert, to encompass in the AWHONS post-birth warning signs. So that includes education that the patient receives on discharge from their hospital stay, and then they get the orange bracelet and are educated along with their support persons on what to watch for and when to return to the hospital and when to call the emergency rooms. We then created our group, which was dynamic. We had some emergency room people, we had our emergency preparedness coordinator, and we really got that group together to work beyond our OB unit. And so we were able to create an education program which included education specific for the emergency room nurses. So what would you see as a patient coming into triage, and how do you need to react? And then we took it a step further, and we needed to get out into the community to the EMS crews and made a specific education for those who are arriving on scene. So what to look for, and we went out to these different EMS services and gave this education. It was about a 10-minute education, but we have a lot of volunteer services around our area. We're very rural, and so we knew that our times, if they're going to pick up a patient, we could have run times of 20-45 minutes. And if a patient is hemorrhaging or seizing due to their high blood pressure, minutes matter. So we needed to get out there and really give the message to them. If you recognize this post-birth alert bracelet, there's things that you can do. There's things that you can put into place, assessments that you can do, communication with your receiving hospital, that you can get that ball rolling so they're ready for you.
How does the Post-Birth Alert Orange Bracelet change on-scene assessment and triage?
One of the big risks is going up to a scene and the patient's unresponsive. They can't tell you anything about what they're experiencing, but somebody knows something and they saw that something is wrong. So by identifying these patients with the post-birth alert orange bracelet, it takes that little factor out of it. So you can immediately start to think toward those 5 highest risk diagnoses. Just tying it into the actual post-birth, postpartum patient really changes that trajectory, because you can come on a scene and see a 25-year-old woman who is unconscious and automatically go to a drug use, for instance. Seeing that bracelet can change that and put that a little bit further back. You also come up on the scene, and we've actually just started partnering with AWHON, and in 2026 they're going to start releasing their bracelet that will have a QR code. So it will say post-birth alert with a QR code. When you scan that QR code, it will take you directly to the AWHON, which is the Association of Women's Health, Obstetrics and Neonatal Nursing. It will take you directly to their website, that is linked to the post-birth warning signs. So you can get a very quick education on what you should be looking for that patient. The goal is when you are out in the community picking up a patient, you do your inbound call, and at the hospital, your receiving hospital, they have an ED partner ready and they have an OB partner ready. So it's very collaborative. There's very clear communication. We're bringing in a patient who delivered on, and it was 3 weeks ago, and this is what she's experiencing. We can then have time to get the team together to be ready in the emergency room at that time.
How is the post-birth alert orange bracelet changing how postpartum patients seek care?
Once a patient delivers, that person is so much more worried about their child that they are automatically put on the back burner. So we've given this education, this Save Your Life post-birth warning signs, we've given it for years. I truly believe they did not see that as important and did not react in the same fashion that they do now. Now that we give this education with their support persons and we give them the post-birth alert bracelet, they see that every day, and that's a reminder that they are still important, their health is important, they're still a patient, and it can go up until that 12 weeks and into that year. I would say in clinics too, just the overall understanding that your risk is not gone at delivery. And we're seeing that patients are intervening in their own care before it becomes these emergent crisis situations. They're paying attention to their body more. They're not disregarding a headache. So you think you have a headache because you're tired, but actually it could be a myriad of other things. So they're listening to their bodies more. We're getting more phone calls. We're having more patients present to the emergency room. They want to get checked out. They're not disregarding these first problems that they're experiencing before they become an emergent situation. The value in it is just, it's so significant because this is such a community that the mortality rate is so high and their needs are so unique that having this information out there has just been has changed the way that people are assessing patients and getting patients in and collaborating with that care.
For more information on the Post-Birth Alert Orange Bracelet program, visit the link below.